At Pabau, we are always looking for ways to improve our videos. Please like, comment, and subscribe to stay in the loop with new content.
Hi, I'm Michael, one of the senior medical content writers here at Pabau. HydraFacial consent is a formal process that ensures a patient understands what a HydraFacial treatment involves before it is carried out. It exists to clearly explain the nature of the procedure, how it works on the skin, and what outcomes and risks may be expected so that the patient can make an informed decision about their care. This consent is important because HydraFacial treatments, while generally safe and non-invasive, still involve active exfoliation, suction, and the application of targeted serums. Patients may have underlying skin conditions, sensitivities, or expectations that need to be addressed in advance. Proper consent protects patient safety, supports ethical practice, and provides clear documentation for the clinic. In practice, HydraFacial consent is typically completed before the first treatment and reviewed again if the treatment plan changes. It allows clinicians to confirm the patient's medical history, current skin concerns, and any contraindications such as active infections, recent procedures, or known allergies. The consent discussion also sets realistic expectations around results, maintenance, and potential short-term effects like redness or sensitivity. Best practice is to ensure consent is informed, voluntary, and documented. Patients should have time to ask questions, and clinicians should avoid assumptions based on previous treatments. Accurate completion of the form and, where appropriate, taking clinical photos helps with continuity of care and treatment tracking. When using a HydraFacial consent template, step 1 is to review the patient's medical history and skin concerns together, checking for contraindications or recent changes. Step 2 is to clearly explain how the HydraFacial works, what products will be used, and what sensations the patient may feel during treatment. Step 3 is to discuss potential risks, side effects, aftercare advice, and expected outcomes, making sure the patient understands and agrees. Step 4 is to document consent by completing the form, capturing any required photos, and confirming the patient's signature before proceeding. In summary, HydraFacial consent ensures safe, transparent, and professional treatment delivery for both patient and practitioner.
Visit our website where we have over 6,000 free templates and resources to choose from.